CVS announced this past week that they're expanding their telehealth initiative, and I think some of the other players are probably going to come into your market and do the same kind of thing, right? So they're going to you're going to have the blurring of lines between who's the first point of contact. Do you go to your employer clinic? Do you go to your pharmacy-led telehealth initiative? How are you guys preparing for potentially new partners and new directions that people are going to come into your health system?
I wouldn't say we have it solved. We are in a fairly unique situation. In Utah, we're by far the largest provider of healthcare in the state. A little over half of it's provided by Intermountain Healthcare, and an insurance product, we're the largest insurance product for healthcare in the state. So we have some unique, that you're not going to find in New York, right? That kind of situation. You have a lot more competition. And so people like, it wasn't CVS, but one of the grocery store chains really wanted to get into the retail clinic healthcare. They came to us to work through it, and ultimately they didn't implement it. But I think right now we're okay because of our size and the stature that we have. But if United wants to come in here and make a play, or CVS, who's a huge player, wants to come in and make a play, we're going to have to figure out and we're talking about exactly the problem you're talking about, Bill. What's going to happen? A lot of this primary care, a lot of this urgent care work is simply not going to be controlled by us any longer. When you have people with $6,000 out-of-pocket limits that they're going to have to hit, and they can go to CVS for $39.95 and have an interaction, or they can go to their iPhone and do it for next to nothing. That's what they're going to choose to do. What we need to become then are the specialists that they can't do over the phone. Pretty tough to do a prostate surgery, over your iPhone. I suppose we could figure that out someday, but I'm not going to try it. Pretty hard to have your annual physical where you have to be touched over the iPhone. So we're going to have to become better at what we do. We're working a lot on access. So where the hours used to be 8 to 5, the hours now start at 6:30 and go till 9, because that's what our consumers want. And we're no longer going to be able to direct them as well as we were able to in the past because of all these options. I think that's great for the consumer, by the way, a little harder on our clinicians, but great for the consumer. So we're just going to have to change our access methodologies. I think we're going to have to become more specialist focused, because that's what they're going to need to come to us for. If they can get the answer to their otitis media for their 3-year-old, either over a telehealth visit or through their iPhone, then they're going to do that. But there are things that we'll be able to do that you can't yet and probably never will be able to do.